Finding the mute button. So Dave, thanks so much. And it's nice to see what you look like since we've talked a couple times, but not seen each other. I'm a kook, and over the years, we've supported the foundation, and there was an occasion, there was a introduction of the College of Medicine here in Seattle. This is 7, 8 years ago. And that was the first time I heard Dr. Tomkowiak speak. The framework of it was, here are all the things we've accomplished on the path to create a rural healthcare college of medicine for Washington State. And here are the things that we have to leap forward to get done to make it a reality on this very tight timeline. I've heard him speak a couple other times, and they're much similar frameworks of all the other things that have been needed to be done to make the program and the service to the communities improve. So without further ado, please welcome John Tomkowiak.
Well, thank you, Chris. What a kind introduction, and appreciate all you've done for the college and for Rotary. I'm gonna, in just a moment, switch to a brief presentation. I'm gonna keep that relatively short, maybe 10 minutes, so I could answer any questions some of you may have about the college and what we're doing. But before I get into that, I just wanna say Elson Floyd, who was really the vision behind the original College of Medicine, he would use this phrase that if you're gonna start a new medical school, it should be bold, audacious, and visionary. And the other thing he mentioned is that he wanted to make sure it was Washington State's medical school and that it served all 39 counties in the state of Washington. And that's what we're endeavoring to do. And I'm going to just briefly tell you a little bit about how we're doing that in the past 7 years. I can't believe I got here in October of 2015, and that's fastly approaching, and it'll be 7 years that the school has been in development. So if you don't mind, I'm going to share my screen really briefly, and then we will just go ahead and for you all, can you see my screen now? Hopefully.
Yes.
Fantastic. Okay. So just tell you a little bit about who we are and our mission. We really want to get to people who live in socioeconomic disadvantaged situations, whether that's in urban areas or rural areas, folks who have problems with access to reliable health care, maybe folks who have issues with getting quality health care. Those are many of the issues that we want to address. And we're going to do that not only by creating the workforce of tomorrow for the state of Washington, but also through research and through direct patient care. And I'm going to tell you a little bit how we've engaged in those three missions already. But I think here, in the end, we want Washingtonians to live longer, better. And so it's not only about treating disease, but it's also thinking and helping us all think about how do we look at wellness and how do we, be more healthy so that we can prevent as much disease as possible. And that's a big part of our curriculum for the trainees, is that we want to make sure they understand not only how to treat disease, but also how to prevent disease. And so our college actually isn't just training medical students. And I hope you all would agree that it really, healthcare, it takes a village now. I mean, all healthcare professionals have to work together on behalf of the patient. And when it works really great. And interprofessional care leads to great outcomes. And there's been many studies that have shown that. There are also some issues when you have lots of different providers involved in the mix. And I know even for myself, my wife, who see folks for our medical conditions, sometimes the information doesn't get handed off to the right people, or they don't know what's already been done, and you have to go through it time and time again. And these are some of the systemic things that we're also trying to train our clinicians in so that they can help solve and fix the system so that it'll be better for all of us going forward. And so we have folks who train in nutrition and exercise physiology. And this is awesome because we use their talent to also inform our medical students and our audiologists that we train at the school about how to be better in terms of that. We do have a very strong speech and hearing sciences program, with a particular focus on autism. And the data shows now that about 1 out of every 42 children born have some symptoms on the autistic spectrum. And so this is something where if the earlier you intervene, the better the outcome for the child is. And we have folks on our team who are looking at intervening as early as 8 weeks old, and we're getting some really great outcomes. And so it's never too early to get these children appropriately diagnosed and into the system. And so it's really awesome that we have them involved in the college as well. We have a couple of other departments, and our translational medicine and physiology department really focuses on taking bench research and then applying it to the real world. I'll give you a couple examples. We have some sleep researchers who do research, particularly with folks who have to stay up for long periods of time and be engaged in tasks that could be life-threatening, like airline pilots who are on very long flights, like transatlantic flights, or truck drivers who might be driving across country and are up for 8, 10, 12 hours at a time driving. Our team actually has developed many of the standards across the United States that airlines and long-distance shipping companies use into how much rest their pilots and drivers should get, when they should get that rest. And that's just one example of how, as a college, we're not only helping all of us here in the state of Washington, but we're helping the nation and beyond in being more healthy. And this comes out of this department, this translational medicine and physiology department. And lastly, we have a fairly new department called community and behavioral health. And we work with lots of communities where we try to figure out on a bigger level, a population health level, what are the determinants of health and how can we change it at the system level? A few of the populations we work with are Hispanics, migrant workers, particularly those folks who maybe have a predilection for diabetes, and how can we better help them manage their diabetes and the outcomes from that. And then Native American populations is another population we work with quite a bit. And again, we try to figure out how do we keep these communities well so that they have less disease. And then in general, in research, if you just think about it, 7 years ago, as we started the medical school, we were doing about $2 million of research a year. This past year, we did over $30 million of research, and cumulatively over these last 6 years, we've received over $100 million of research funding in all different areas. And we're really proud of that. We went from the 154th, which was last place in doing research, to 106th in just those 7 years. So we've already jumped over 50 schools who have been well established for a long time. So we're not only making a practical difference, but we're also making a difference in terms of discovering knowledge that we can use for the future. Well, our medical students and our clinicians that we recruit to the program, that is really a very important part of what we do. All of our students have ties to the state of Washington, and that's because there's plenty of studies out that show that if you train in a medical school and you finish your residency, there's an 85% chance you'll stay within a 100-mile radius of where you finish that training. So we're really proud of the fact that all of our students have ties to the state of Washington. And in addition, I've thrown up some numbers here. There are a few other things we're really proud about. Because we want our graduates to eventually practice in rural areas, we recruit from there. And so about a quarter of our students actually come from rural areas. We have over 50% of our students who are from socioeconomic disadvantaged backgrounds. And then one of the numbers that's probably most impressive for a medical school is the number of first generation students. In medical schools across the country, that number is usually less than 10%. And we have over 30% of our students are first generation. So we're really giving opportunities to students in the state of Washington who previously probably didn't have the opportunity to go to medical school and pursue their dreams. So we're very proud about that. Well, we don't do this alone. We are a community-based medical school, and a community-based medical school means that we rely on other healthcare partners to train our students in concert with us. And we have sort of 4 campuses in which we then have clinical experiences in and around. So Vancouver, Tri-Cities, Everett, and then Spokane. And our students all spend 2 years in Spokane, and then their last 2 years of the program are in these other communities. And then from those communities, we send them out anywhere from 60 to 100 miles out in more rural and underserved areas so they can begin to understand what it's like to actually practice in those areas. And if you look at sort of a map of some of our partners, and this is only a partial listing, but you can see we have our over 250 partners that goes from very large health systems like Providence, Multicare, Kaiser, to big clinics like the Everett Clinic or the Vancouver Clinic, to smaller hospitals like critical access hospitals. And then, of course, we have smaller clinics in and around the area. You might be surprised to know that already after just 7 years, we have a total of 1,700 physicians, 1,700 who help us train our students. So everybody across the state has pitched in and has agreed with us that this is a really important endeavor. Well, we do have our own practice, and our clinicians at the Elson Floyd College of Medicine, along with our colleagues in pharmacy and nursing and a few other programs, we've started an interprofessional clinic, and we're starting to directly deliver care across the state. Most of the work has been done in and around Spokane. We've done about 7 counties that are in and around Spokane. But this next year, we're going to take the next step and begin expanding our services in and around the Tri-Cities area. Directly after that happens, we're going to do it around the Everett area and then around Vancouver. And then, you know, we're going to get to all 39 of those counties. But we've already made a significant impact. You can see just a few of the things that we've been doing. But I think, you know, the most valuable thing we are is we talk to communities, and we don't just show up and saying, here's what we have to offer. We talk with communities first and say, well, what do you need? And then how can we meet that need? And many times we're also a conduit. We work with other healthcare organizations to try to find, you know, all the right services for a community or, you know, whatever organization we're trying to help. So that's one of the things that's, I think, great about the College of Medicine is if we can't do it ourselves, we're going to look for partners and other folks who can make that happen. Well, and I just want to say a little bit about Chris Carlson and the amazing work that he's done with our college. Very early on, had a chance to meet with Chris, and we were talking about, because of the kind of student we recruit, many who are first generation, many come from socioeconomic disadvantaged backgrounds. Student indebtedness is quite a barrier for them. If you just look nationally across the US, students will leave medical school with about a $200,000 deficit. Because of the kinds of students that we recruit who already have some significant deficits coming from college, the average deficit for them is actually closer to $240,000 or $250,000. So whatever we can do to try to raise money to give scholarships so they can pursue the kind of careers they want to, and they don't have to think necessarily about money or financial resources, we absolutely want to do that. And so Chris has helped start this Rotary scholarship, which has been endowed. It takes $25,000 to endow the scholarship. We have now over $40,000 thanks to Rotarians across the state. And we're really grateful for that. And so we award 4 students a year a scholarship, and then that scholarship will continue across their 4 years. And all of these scholarships really are amazing and help. And so I'm going to stop sharing. That is just a brief snapshot of some of the many things the college is engaged in. We've grown very quickly in just the last 7 years. Lots more growth and fun things ahead. But I'm going to stop here, and hopefully if y'all have some questions, I'd love to answer.
Let me start with a question. How do you select the recipient of the scholarship that Rotary's endowed?
Well, if Nancy is there in person, I'm going to let Nancy talk a little bit about that. Nancy?
Yes, the student has to meet the 4 ways of the Rotary, and we have guidelines that they have to follow. They submit essays, and the scholarship committee reviews the essays and selects the best students that matches the Rotary mission and the medical school mission.
Thank you. Looks like former hospital administrator Bob has a question.
I'm just kind of curious, you talked about all your partners, and how do you ensure as your medical students graduate that they get into residencies and internships and residencies that will get them to board certified and still be available to the smaller communities, oftentimes getting sucked into Seattle or wherever it's multi-specialty groups do not serve the rural communities with gynecology, orthopedics, general surgery online?
Yeah, that's a great question. And so that's a really a part of the next big strategy for the college that we want to undertake over the next 5 years, which is building that next piece of their training, which is graduate medical education or residency training. We already have done some of that. We've built a residency in Everett with Providence. It's an internal medicine program. We are 1 year away from opening a family medicine residency in Pullman, Washington, with Pullman Regional. And that residency actually is going to be a very important one. We will be the second medical school in the country who has started a residency at a critical access hospital. By definition, critical access hospitals can only have 25 beds or less. And so it does become sort of an administrative and logistic challenge to make sure you can have a program at such a small hospital, but ensure that the residents get to see all the kinds and volume of patients that you would expect them to in any other program. And we've managed to do that for Pullman in part by using other partners in and around the area. If that program is successful, like we think it will be, it will open up the door for us to create other kinds of programs in more rural areas. And then, the numbers that I described to you earlier will apply, and 85% of our graduates who end up in those programs will stay within a 100-mile radius. And so that's the next part of our mission, and our strategy is to grow many more of these programs across the state, particularly in rural areas. Just to give you some numbers right now, of all of the residency spots in the state, which there's about 2,600, only 200 of them are east of the Cascades, and only about 250 to 300 of them could be considered residents that are training in more rural or underserved areas. So that is a really important point, and it's one we certainly know about and are addressing. So thank you.
Anyone online have any questions? I see Dr. Harmon's logged on. Any other questions here?
Yeah, John. PDWU in Yakima, starting the dental school with the exact same mission that WSU had with rural dentists and stuff. Are you partnering with them, or were you giving
Well, we're not,
lead
so,
that rural dental?
yeah, so a couple points. So, first of all, that's a great thing that PNWU is doing, because in all of our community assessments, definitely dental care always comes in the top 3 needs of communities. And so that's a really important endeavor. Secondly, starting a dental school is a very expensive endeavor. When I was at New York Medical College, we undertook that. And, you know, I really appreciate that, that question for 2 reasons. Obviously, with the pandemic, we've definitely seen an erosion of confidence in not only the public health sector, but just healthcare in general. And, you know, as I talk to my team about that, and our students who are going to be our future clinicians, you know, part of the solution will be really just one conversation at a time. And we also need to think systematically about how we can build trust back up again in some of our healthcare institutions who are doing great work. So our new Department of Community and Behavioral Health, a part of that department's mission is public health along with population health. And we have folks who are expert. We have one of our faculty, for example, was tapped to serve on a national workforce with regards to how do we reimagine public health, and how do we sort of do more PR work in terms of the public health work that we are doing across the nation at various medical schools and academic health centers. And we have other faculty who are focused on the curriculum and helping our students understand more about public health, but also how they can be practical advocates for public health, whether it's in their community, their local government, at the state level or federally. And just as an example, we had one of our medical students who took a year off because she was working with the AMA in their public policy division, better understanding how policy is advocated for at the federal level with an organization like the AMA. And you know, that's a real hard position for a student to get. There's only one of those a year that are given to students, and our student got it, and we're really proud of her. But you know,